Cognitive testing can diagnose this, and treatment is important. These are more vulnerable people who are not yet in a position of requiring more general care, but they are more vulnerable. Now here I'm going to go back to the thing I said I was going to say at the end, and that was the reserve hypothesis. This is a very important idea both physically and psychologically. That is this, that when we are younger, we have much more in the way of reserves. This is true physically. Let's say we want to walk up to the grocery store. Okay, when you're 30, 20, 40, you can walk up there and you can walk fast or slow. You can run a little bit of the way if you feel like it. You have respiratory reserve. You may be just as well able to walk to the grocery store now as you were then, but you don't necessarily have the same degree of reserve. You can't necessarily go faster. You can do the job and you can do it just as well, but the reserve is not as great. This is true of things like kidney function. Just stay in the physical realm for a minute, right? I mean, we have got 2 kidneys, thank God, and one of them goes out, we can always use the other one. We've got a lot of reserve. Cut back on that, we reach a point where there may be significant kidney difficulty. So this is true in every one of our organ systems, and this is true psychologically as well. So that the reduction of stress, getting help from others and from ourselves in the organization of our lives, having a degree of regularity to things, keeping things not more complicated than we can deal with, these all keep us within the reserve area, right? Is that, I mean, it may take a while to kind of absorb that, but to me it's a very useful thing. There's just lots we can do so long as what we set out to do is within the area of our of this capacity. And we can set out on something, but we can't do as much in addition as we used to be able to do. Okay? I'm not going to go into detail, I recently had an example of this in myself. I set out on a rather strenuous hike. I do a lot of hiking. And I have prepared by going up and down Euclid Creek Park several times, which is quite a hill and up and down. This involved a lot of hills. Well, I exceeded my reserve. I got out there and I was having to lay down in the path and put my legs up in the air and rest for 15 minutes. Finally was able to do it, but it was not, I didn't really know what my reserve was, but I tell you, I found out. Survived it, because here I am. But when I was over there lifting my knees up like this, I was reminded, you know, there's only so much of that you and I can do at a time. Okay, now what are then some of the major disorders that we all can experience at this point in life? I've kind of listed these in an order in which I approach them in seeing people. Severe anxiety is a very common aspect of our lives, and it comes when we are facing this situation of helplessness. If you were not in Kendal at home, I would guess that many of you, certainly I, would be experiencing much more in the way of anxiety about a whole lot of issues. What am I going to do? What am I going to do if my wife gets sick? What am I going to do about meals if I can't get to the grocery store? What happened if such and such? Well, we all have available resources to help ourselves in that regard. So severe anxiety, I mean, degrees of anxiety, I mean, we all get anxious about things. I'm anxious about giving this talk, but I can hopefully deal with it. I mean, I'm anxious about a lot of things, as you are, but mostly to a degree that we can deal with. But we also, many of us, have anxiety that becomes unmanageable and becomes unhelpful to our functioning. The second major issue that we all think about and get worried about is depression, which afflicts 6% of us over the age of 65. And finally, but not by far and away not the least important, are our concerns about dementia, which afflicts those, 10% of those over 65, and to one extent or another, but still within the realm of dementia, which means a degree of lack of capacity for self-functioning, 50% over the age of 85. Alcohol and substance abuse, you would be happy to know, is much less common in us guys than they are in younger people. So these figures are, in this area at least, are less than they are in other age groups. And drug abuse is mostly not through any kind of conscious wish to do so, but has more to do with issues that arrive with the medications that we get from our physicians and situations that become, through the utilization of drugs that have a capacity for dependence, we get into situations or pain which become somewhat unmanageable. Okay, we all get anxious, we all get depressed, and as we've said earlier, we all have a degree of cognitive emotional change. So the issue is not to look inside and see whether we feel these things sometimes. The issue is whether or not we are functioning within the realm of competence in dealing with our daily lives under the circumstances that we live, all right? I mean, if you live in a more, let's say you're living, if you're living alone on the 6th floor of a apartment house where the elevator goes out all the time, I mean, you obviously are living in a very different situation if you're living in a home with a wife or family. It's all one floor. You have easy access to things. You obviously have a very different kind of a situation. And so the level of these things has to be seen in terms of function. Function is the issue, not the feeling in and of itself. Okay, so now we're going to talk a bit about some of the forms of anxiety. It appears often as a phobia of certain situations. I don't want to do this, I can't do that. Generalized anxiety disorder is a very painful situation when it gets very severe. Just everything makes you angry. I worry about this, I get that taken care of, I worry about that. Just the whole world just seems like it's a lot of things to be worried about. Panic disorder, which is a very painful state to be in, is a feeling of inescapable doom, where you feel that things are just closing in on you, you think you're going to die. Commonly with a panic disorder, you feel you got to get outdoors, I got to get a breath of fresh air, if I just get outside, I'll feel better. It's a very significant illness. This is an illness, and it can be treated, and it can be treated effectively. And finally, there's obsessive compulsive disorder, which all of us have to a degree. I mean, all of us have little compulsivities, which are okay, so long as we're functioning okay. But if it becomes just a circle of rituals, or becomes things such as hoarding, becomes where life has to stay within a very narrow boundary, this is obviously interfering with functioning. Okay, so these things result in much suffering. Suicide is a very significant complication of severe anxiety disorders, and treatment is available and it's generally effective, especially if treated early. Those who have particularly those who have panic episodes, need to be seen by someone who is knowledgeable and can help deal with them. Okay, both medication and psychotherapy can be effective. The combination is even more effective. So I'm a talking doctor myself. I give medication, but most of my work is in the talking area. So I'm very much pushing or believe in the value of discussing our issues, not necessarily with a psychiatrist, but I do think with a professional, social worker, psychologist. There are a lot of good counselors in this area, graduates of the Cleveland State program, which is terrific. There's a variety of professionals available who maybe can help in this regard. Okay, what about that bugaboo depression? First thing you know about depression is it often appears in the elderly. We still call it depression, even though the experience of it is not necessarily one of feeling depressed. It very often appears as irritability, getting angry about everything, feeling on edge all the time, snapping out at people, this kind of thing. And that very often is within the realm and treatable within the framework of depressive illness. Now let me add, I mean, this is sometimes a concern. We've all got things to be sad about too. Loss is a part of our lives, right? And so we can feel sad about things, we can mourn that which is lost. This is not depression. That's not depression at all. That's human life. That's being a human being. Depression is when it is something that closes in on you, where everything is black. There is no way out. It just feels as though you're contained. And with this irritability, angry kind of thing, it's just nobody knows what I feel. You guys are all wrong. I mean, don't try to talk to me about anything. That kind of thing is, that's not in relation to reality. That's in relation to something going on within oneself, largely physiological, but also psychological to a degree. So people with depression have significant weight gain or loss. There may be sleep disturbance, but we all have disturbance of sleep, so we don't overemphasize that, right? You really overdone fatigue. Me, I take a nap every day. I get fatigued like I didn't used to. Every afternoon I see patients, but I also have a block of time in the afternoon when I take it out and I take a nap. Between you and me, don't tell my patients. Anyhow, no, tell them. I don't care. I tell them. I mean, I think that's to be rested, to treat our fatigue with respect, and not kind of feel like you got to do what you did 20 years ago. That's the essence of living our life the way we need to think about it. Feelings of worthlessness and guilt are obviously inappropriate. Diminished concentration, we're indecisive, thoughts of death, and there is suicide risk, particularly in men. Because men traditionally have had far more difficulty acknowledging difficulty and seeking help. Within all of this is the idea we're able to seek help. We need, at times, help. All right, these are the forms of depression, which I will don't try to even remember them at all, but just to get the idea that there is an acute form of depression, major depressive disorder with severe impairment for more than 2 weeks. Dysthymia is a chronic depression